Hi, Dr. Deepthi. Welcome back to Accuracy's podcast.
Hi Praveen, it's nice to be back here.
So, we used to get a lot of inquiry about vitamin D. So, I would like to know more about it. Can you tell me what is vitamin D?
Yes, sure. It's actually a very interesting vitamin. Although it's fat soluble, in our body it also exists as a hormone.
Okay.
The main job of it is to regulate calcium and phosphate. Now, these two are very important for our bones and teeth to stay strong and healthy.
Okay.
So, in short, vitamin D actually in our body has more function than just a vitamin.
Okay. Can you tell me why is it called as sunshine vitamin?
Oh, okay, that one's actually my favorite. Vitamin D gets this nickname of sunshine vitamin because when we are exposed to the sunlight, our skin is capable of producing vitamin D, specifically when you're exposed to UVB rays. Now, not many vitamins are capable of doing that, and that kind of makes this vitamin D quite unique.
Beyond bone and teeth, what other benefit vitamin D has?
So, a lot of people don't realize this, but vitamin D also plays a very major role in our immune system. It helps reduce inflammation and it also helps our body to fight off infections very effectively.
And doctor, I heard it also affects your mood and sleep. Is it true?
Oh yes, it is very much true. Actually, there are a lot of researches and studies that show a very direct link between vitamin D and sleep problems and mood variations. Now, this also happens more during winter and in places where there is less sunlight.
Okay. Can you tell me who is more at risk for deficiency?
Quite a few people actually. Anybody who is not having a lot of exposure to the sunlight, mostly people who spend a lot of their time indoors, then older adults, and also people with darker skin, since melanin that reduces how much vitamin D skin can produce.
Oh, okay.
Yeah. So all these people are at a higher risk.
Okay. Okay. So, what common condition in children that directly linked to the vitamin D deficiency?
Okay, so a common condition in children which is directly linked to vitamin D deficiency is called rickets. Now, in this, the children they have a very weak and soft bones. Now, this happens because of low calcium. Now, when the vitamin D specifically is low, the body is not capable of absorbing calcium, which in turn causes the softness of bones.
Okay, can you suggest some food that can help to boost vitamin D naturally?
Yes, of course. So, food wise, there is fatty fishes like salmon and trout that are very good sources. And then we have fortified foods like milk and cereals that are also very good sources of vitamin D. And very interestingly, we also have mushrooms which have been exposed to UV. They also help produce vitamin D.
So, why should people be cautious about supplements?
Okay, this is very important part actually. Now, vitamin D is actually a fat soluble vitamin, which means that once you take it, it's going to stay in your body for a longer time. Now, overuse or taking vitamin D very frequently can cause toxicity. And that's why if you are taking supplements, you have to do blood tests to know your levels.
So, how do doctors test for vitamin D deficiency?
It's actually a very simple blood test. Now, the doctors, they will request for something called a 25-hydroxy vitamin D blood test. Now, this will determine whether you are low, borderline or right where you should be.
So, doctor, what's one myth about vitamin D?
So, a really common one is thinking that exposing yourself enough to the sunlight, you will get enough of vitamin D. That's not true. So, if you're spending a lot of time indoors or you're covered up, or you live in a space where there's limited sunlight, your body might still not be making enough of vitamin D. So, it's very important for you to get checked.
Okay, so what's a simple takeaway message?
Okay, so a simple and a big one actually is vitamin D does a lot more than just support your bone health. Like we discussed, it also plays a very major role in your immunity, mood and sleep and in overall your well-being. And the reality is that a lot of people around the world are not getting enough of it.
Okay.
So, it's very important for you to check your vitamin D levels regularly.
Yeah, I think it's time for me to check my levels.
Well, what are you waiting for?
Yeah.